I'm Bill Thorworth, a practicing radiologist and member of the RSNA Board of Directors. At our annual meeting in 2012, the RSNA launched the Radiology Cares campaign. It is our strong belief that in the ever-complicated and patient-centered world that we practice, that we must not lose sight of the vision statement of this campaign, which is that patients are the focus and primary focus of radiologic care. We all became health professionals in order to take care of patients, and we should never lose sight of the fact that they are, in fact, our patients.
From a patient perspective, I think patients would love it if a doctor comes out and say, hey, listen, we found this in your MR, I'm going to talk to your doctor, this is the problem, and if they can see the image even, you know, it's for them, for the patient, it's priceless, I can tell you that. I actually do that a lot with my patients. I bring them to the rooms, I show them the pictures, because if they see it, they understand.
He looks at my MRI and things look good. He takes my hand and he tells me, Christine, continue to do what you're doing. You know, he empowers me, making me feel confident that I have control over my health and that I need to continue to live out the life that I'm living and that that's the way I should be tackling this disease.
You have to treat each patient with the empathy and respect that they deserve. We all have been patients, or will be patients. Would we expect anything less for ourselves or a loved one?
I always kind of approach it as do for someone else the way you would want somebody to interact with you. I think that it helps a woman get through that difficult time of the unknown, that somebody does personally care about her as a person.
She saw that I was in distress, and she sort of broke that fourth wall of doctor-patient and gave me a hug and communicated to my mother that she understood that I was in distress and she really wanted to comfort me. That made me feel like she had connected with me and I wasn't just, you know, a body with a tumor that she had to biopsy.
Our involvement is not limited to the exams and procedures that we perform and interpret. Rather, we are responsible for the entire continuum of the patient's experience with us. We have to operate completely as a team. The receptionists, the technologists, the radiologists, and all involved in that entire spectrum need to be patient-centric and making sure that they have that patient's well-being and comfort in their mind. Optimally, the referring physician, when they have a clinical question, will consult the radiologist.
I love it when radiologists go over and re-look at that kid that I ordered the x-ray of the leg on and say, you know what, I think he's tender in a different spot than you wanted me to look at, so if it's all right with you, I'm going to x-ray a different spot. And I'm like, that's great. Or I've had radiologists interact with the patient and then call me and say, you know, they told me that they're on this medicine, and did they tell you that? So sometimes things come up in those interactions that maybe I didn't get in the first time around. And that's a fascinating moment.
Patients are becoming ever more critical consumers of the care that they receive. So when they come with questions, we need to be sure to be open and receptive to that process.
I think it's important for us to, you know, let patients know that yes, we have that medical expertise, and in presenting to the patient that way and sharing our insight into these images and how it applies to their health.
Radiology is not only the practice of procedures and interpretation of exams, but it's the practice of taking care of patients who have concerns or illnesses that need help from our expertise.
If you tell them everything that's going to happen, they already know, they're prepared. They know what's going to happen, and they know what to expect. So at the end, they may come out and say, hey, it was a great experience. It may make a big difference. So talking to the patient for me is one of the most important things.
What's so important, at least for me as a patient, is to be able to interact with the person reading the film. And I just feel, you know, just having cancer, feeling overwhelmed, and what a special part that you could be part of that person's journey and making them feel comfortable, making them feel less overwhelmed.
Clearly, patients' health and their very lives are impacted by radiologists. We want every patient to leave with a positive experience and to recall the radiologist as an important part of their health care.
Again, it makes you feel in control. You feel, I can fight. With these folks in my corner, I can fight and win.
Please take the time to visit our website at radiologycares.org You'll enjoy the experience of practicing the art of patient-centered radiology.